Welcome, 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 my Be Health Empowered family. Back for another week of Excuse Me, Doctor. My name is Dr. Melissa Clark. Of course, call me Dr. Mel. Really love you to do that. And I would also love you to know that we are here each and every week bringing you the information that you need to make wise health decisions for yourself, for your family, and even for your community. And if you are logging in for the first time and watching us on Facebook, please hit that subscribe button. And if you are checking us out on YouTube for the first time, actually, please hit that subscribe button on YouTube. I'm going to get this right, and hit that like button on Facebook. Thank you so much for doing that. And now, in order to create this amazing week that we are going to help create with this show, I have to welcome not just you, the audience, but I have to welcome my incredible co-host, Mr. Wayne Bruce, Miss Lila Mays. How y'all doing?
Hi.
How y'all doing?
I really would like some hand claps when you are bringing us in, Wayne. I'm not sure why we're not doing that, but
yeah,
that's thank you. Hi, everybody.
Hi, everybody. You want? I mean, let's come in with like this.
Thank you.
I think the hand claps. Are enough.
Some kind of fanfare.
I'm happy y'all are here. I mean, because we have an amazing show today. We really do.
We do.
Okay, now.
So
the amazing show, we got to announce the amazing show since you had the drum roll. It is basically what is lurking in your mouth.
Child, look, if you are not taking care of your mouth, you might be putting your whole body at risk.
Yeah.
Right?
This is true.
Yeah.
This is
you
true.
Might be putting. Yeah, your dentist can tell everything what's going on, man. You go into your dentist.
Yeah.
Man, it's
right. You can help prevent a lot of issues down the line. And we're going to cover all that, like optimal oral care, what your dentist can help you know what's going on with your body, everything from that to how do you afford dental care, right? What are the main things that you need to know about your dental health, how to afford it for yourself and for your children, because it's especially important in children. So stay tuned. We are going to get to all that and more.
Okay.
So share it.
But first, but hold on. I need this again. But first, the weekly recap.
We cannot have a drum roll with everything. I'm just saying. But yes, these are some drum roll items that we have on the recap for real.
Listen, I'm gonna jump right in here. The number one thing on our weekly recap here is these STIs that are sky high for people over 55. Look,
and what are STIs? What does STI stand for?
Sexually transmitted infections.
Woo. There you go.
Right?
That's painful.
Yes.
Yeah. The people over 55 are getting it in. But listen, let me tell you what else is getting it in. Chlamydia, gonorrhea, syphilis, all of these things are on the rise in people over 55.
Yeah, and this was a new study, recent data that just came out. It showed that rates of those things you just named, chlamydia, gonorrhea, and syphilis, have more than doubled between the years of 2012 and 2022. So
why, Dr. Bill? Why is this happening?
So, well, a bunch of different reasons. These are some of the reasons that we think. So people are living longer and, staying healthier longer. So they have active lifestyles, which include having sex into their 80s. There was one study that showed that 40% of people aged 65 to 80 are having sex. And, there are factors for why sexual health is sexual activity is continuing on. Yes. We all know some of them, right, Lila?
Yes. Some of them include hormone therapy, like Viagra and things like that, for women and men. And certainly a lack of sex education for people who got married early. And then here's the one that jumped out at me. The sharing of partners, not that the sharing of partners is news, but because, there are fewer men, the ratio of men to women is
Right.
a big gap there. Yeah.
It goes down as we age, right? There are more women, and so people end up sharing partners who might not have shared partners when they were younger.
Right.
And there are also physical factors, right?
Mhm.
So your immune system gets weaker, so you're more likely maybe to pick up diseases you're exposed to. Being able to put on a condom, that
Yes.
your physical dexterity may go down as you get older.
So
And on
hold on, Doc, I gotta stop y'all on that. I mean, we
hey,
gonna
it
fumble
could be a factor.
Are we're talking about fumbling the condom?
Brothers,
That's going to be
Fumbling the
that's
condom.
go-
might.
I'm sorry. I'm sorry. I lost it.
They
Let's go.
might.
Well, it could happen. It could
How about
happen. And
people
then on the
just
flip
doing the
side,
nasty more?
well, that
Well,
is one factor, and it's not nasty because we don't want to
I
put any
know, I
stigma
know.
around it.
I mean,
We want people to talk about their sexual health with their
Yeah.
doctors, and if they think of it as the nasty, they're less likely to have those conversations with their doctors, where their doctors may remind them to wear a condom, or
Right.
may ask about their sexual activity, or may think to check for syphilis or gonorrhea and chlamydia. And one of the issues we're seeing with doctors is they've gotten so out of practice for checking for syphilis, for example,
That's it.
that they don't even recognize it when they see it to think to check for it. So
And
all
doctors
these
stop asking,
issues, they
right?
stop asking, they stop counseling, they stop reminding people. So all these things are factors for real.
Yeah. So we have to give the seasoned folks, they get the same message as the young people having sex. Use condoms, get tested, and talk to your partner. You have to talk to your partner and ask your partner questions. I don't care if you're 80, ask questions.
I mean,
Exactly.
it might be their second or third partner in life, if they've been married for a long time
Yeah, that's true.
and something
Exactly.
happened, people are saying in the chat, celibacy until marriage. But how about this? If you already been married once, what happens then? I'm not gonna say nothing, but I'm gonna let y'all think about it. That's what we're gonna do.
Right.
Anyway, so yeah. Next, Dr. Mel.
What's
This
up?
got me because I'm a serial dieter and work. I'm up 20, down 30, up 15, and the thing that worked for me was intermittent fasting. Eating within a certain period of time and not. Now, should I be afraid of that? What's going on?
Well, no is the short answer, but let me tell you why we have it on here. The American Heart Association came out with this study last week. It was presented at their meeting that showed that intermittent fasting could seriously raise your risk of death from heart disease, which sounds very scary. However, there's tons of research before this that shows that time restricted eating, which is another word for intermittent fasting, typically you get all your meals within an 8 to 10 hour window, can actually improve your insulin sensitivity, which means it makes the insulin that you make, work better. So it protects you against diabetes, decreases inflammation, decreases obesity and cholesterol levels. So, track record behind this intermittent fasting. But this new study suggests that there is this higher risk of heart disease. But it turns out that we don't have to be concerned about this finding, because what it specifically says was that it was linked to a 91% higher risk of cardiovascular death. The key is linked to. And it turns out that people in this study, there were more men, there were more smokers, there were people who had higher BMI, meaning higher weights. And so it wasn't a well done study in terms of controlling for these other things that can lead to heart disease, right? There was also no information comparing the stress levels between the different group, the sleep habits, the work habits, the nutrients that they were eating, right? So you have to be very careful in interpreting research. A study, for example, might show that you're more likely to drown if you've recently eaten ice cream. Yet if you look closer, and you see people who eat more ice cream eat it in warmer weather, when you're more likely to be swimming and drown, it doesn't necessarily mean that the ice cream is causing the
Right.
drowning. So similar
Right.
here. It
Mhm.
doesn't mean that the intermittent fasting is causing the higher rates of heart disease. So you can continue to do your intermittent fasting. More research needs to be done to actually figure this out. But don't stop now.
Well,
Not
don't
because
stop
of this.
now. That's the
Not
key
not
thing.
because of this. Yeah.
Thank you, Dr. Mel. That made me
Thank
feel.
you. Exactly.
I
Thank
mean,
you, Dr.
Yeah.
You made
Sure.
us feel better.
All right.
right.
Moving on to 4 key foods to help your brain, Dr. Mel. Talk to us.
So it turns out that our diets do have an impact on our risk for Alzheimer's disease and dementia. And there's a specific diet that's been tested called the MIND diet, MIND, that helps to decrease the risk of dementia. And even if you only stick to this MIND diet half the time, it can cut your risk of dementia by 37%. So this is one where you don't have to be perfect all the time. So
Okay.
number 1, swap out red meat for lean proteins like fish, eggs, beans, tofu. They have lots of vitamin D and vitamin B.
Okay.
You also want to swap out white grains for whole grains.
Like brown rice or quinoa.
Exactly.
Okay.
Yep.
Wow.
Then you want to load up on your leafy green vegetables because they are full of nutrients that boost brain power, like lutein, beta carotene, and folate.
Okay. All right. So salads, leafy greens, spinach, collards, all the good stuff.
All of that, right.
Okay.
Then you want to go nutty with the nuts. So get your nuts, your seeds, your plant oils. Those are great sources of something called omega-3 fatty acids, which help to build our brain. And we have to take them in from the outside because our bodies don't make them. So really important to get the nuts, seeds, and the plant oils.
Okay.
Okay.
If you're not eating nuts and seeds, what happens? I mean, if we can't get it.
Well, you can then have problems with your blood vessels hardening of the arteries, which leads to heart attack, leads to stroke, and also may cause higher rates of dementia down the line. So you want to get those in.
And you can add that stuff. You can add like chia seeds, flax meal, peanut butter, avocados. Drop those into some smoothies and drink them.
Yep. Delicious. Yep. And the key is, like I said, even if you just hit all this stuff 50% of the time, do it for life, right? Adopt it as a menu. Like think of it as menus that you could choose from as opposed to a diet, right?
Right.
Yeah.
So that's the key.
Lifestyle.
That's the key.
Okay.
There we go.
All right. So that's the recap. What else we got?
What
y'all think? What is up this week?
That tickles me. That makes me laugh. I had to put my glasses on, brims and specs. But so look, I did the people didn't want to talk about this on camera, Dr. Mel. So we did a poll on social media, and we asked the people if actually what we asked was, how regularly do you floss? Once a day, twice a day, or open? Most people said once a day. Some people said they don't floss at all.
That doesn't surprise me.
I have to say, the brothers said they floss twice a day. So the brothers who responded said twice a day.
We're not talking about riding a car around the block. That's flossing to them.
No, we're talking about flossing your teeth. And the way we asked it on social media,
you defined flossing.
What about them people with the teeth like this to be flossing with jump rope? What happened?
Okay, as long as you get it. And the way we asked the question was, how do you really floss? Like not just to get a little piece of steak that was stuck there, like floss to mitigate plaque buildup and all of that, like what your dentist asked you to do. So that's what we asked people. This
how
is how
many
they
people?
respond.
Okay. We need to know put it in our live chat or what. We need to know how many people is really flossing. And we ain't talking about riding the car around the block. We talking about flossing.
And then when this is a great segue to our actual topic for tonight, because I am going to ask our esteemed guest, very experienced dentist, whether what we are seeing in the chat in terms of percentage of the time is actually what she sees in her experience. I'm just saying.
Okay.
But I'm curious
Right.
to see what people put in the chat. I, for one, I'm going to say, I admit I don't floss every day. I try, but I don't always get around to it. So,
Got
but I
floss
do.
sticks.
I floss
do
at
it.
least once a day.
My
When I'm on
dentist,
See?
I can tell you I floss like 3 times a day, and my dentist will come on here and tell me I'm a liar.
Right. You can't fool your dentist.
Exactly.
Ain't no fooling.
Water pick,
Exactly.
floss. Yvonne
There's no
Z
fooling.
says flossing, water pick, brushing. What else?
Okay.
You name it.
All right.
All right.
Well, on that note, thank you, Yvonne. And we're going to hear from y'all later from the chat. I will see y'all, Wayne and Lila, back in a little bit, because we are going to go into our topic for tonight, which is all about dental and oral health today. This is our first time covering this topic. And by the way, we have been on for 4 years, y'all, this month. It all started in April of 2020. And the fact that we have not covered dental and oral health yet it is not good. So we have this wonderful show lined up for you tonight, because there is so much to know about our dental health. And we have an incredible guest, Dr. Tamara Stockton, who's a general dentist and the director of Well Partners Dental Clinics, an entity of the United Way in Midlands, South Carolina, which collaborates with hospitals to completely fund 2 free children's dental clinics and 2 adult dental clinics for low-income residents in that area. Welcome, Dr. Stockton. Thank you so much for coming on.
Thank you for having me.
Absolutely. And I have to say, the reason we're doing the show is because of you. When I told you about my show, you said, have you ever done dental care? I was like, no, we have to have you on. So thank you so much for that. And I want to just ask, what was your journey to dentistry? What inspired you to become a dentist?
So I love to educate. I first wanted to be a teacher. Then a hygienist came to our school, like many times in elementary school, and they spoke to you about, this is what you do, brush your teeth, floss. And I was like, well, I could be a hygienist. I could educate, and I could also work in the mouth. And then when I went to undergrad, my advisor was like, why do you strive so low? And I was like, a dental hygienist, that's not low. I grew up in an area where there were no minority doctors, hygienists. And so I thought I was really aspiring for something great. And she was like, no, you can do more. And she saw more in me than I saw in myself at that time. So I'm just grateful for the push. So that's what led me to become a dentist. Yeah. So.
A shout out to the advisors of the world, right? And you mentioned that there was a disparity, nobody that looked like you in dental care where you grew up. Do you know, are there racial health disparities in terms of diseases of the mouth that occur more in disadvantaged or minority populations?
Due to the lack of education, yes. A lot of times there are not a lot of dentists that look like you, and so the education is not there from the beginning. And so they don't know to brush their teeth. They don't know to floss. I was very interested at your polls that you took, but people don't really think about your mouth until it hurts. So definitely it's more of a lack of education, a lack of knowledge about it. And that's what causes the disparities.
I totally understand. As an emergency physician, I took care of a lot of people with dental emergencies. And like you said, it's not something people really think about until it causes pain, much like other things in our life, right? And a lot of times the source of that pain are cavities. So talk to us a little bit about what are the danger of cavities? And what could they potentially lead to if untreated?
Right. So cavities, to get a cavity, what is a cavity anyways? That's a lot of times people are like, well, how did I even get a cavity? It's multifactorial. You have to have the host, which is the mouth. You have to have the bacteria. And then we all have bacteria everywhere, but it's the amounts of bacteria that we have. And then if you feed the bacteria, and how do we feed the bacteria that causes cavities? With sugar. So if you eat a lot of sugar in your diets, you have the amount of bacteria, and obviously it's in your mouth and you're not taking the bacteria out, it causes the cavities to form, which a lot of times you don't know you have a cavity unless you go to the dentist. Cavities don't hurt. When cavities start hurting, that means that the nerve is involved. When the nerve is involved, that's a little bit more aggressive. So then that leads to a root canal. Then that leads to an abscess, because the bacteria has to go somewhere. So if you're not taking it out.
And help us with what's an abscess before you skip over that?
No problem. So an abscess is basically bacteria when it goes through the tooth into a different fascial space. So basically into your gum tissue and your bone. So then it starts to swell. Basically, it's just a mass of bacteria because it has nowhere else to go. So that pus
is pus in your mouth, right?
Pus in your mouth, So that's basically what an abscess is. So then, it can travel. So years ago, you probably heard of the kid that passed away in the DC area because he did not get dental care. The abscess traveled to his brain and he died. We don't need that to happen. So that's why it's not just a cavity. It can lead to so much more.
It's some serious issues to, cavities, not taking care of your teeth, and like you said, bacterial infections that can spread to your brain and other parts of your head and neck, and cause some serious problems. So what about chronic diseases that adults have that are associated with poor dental care? So talked about cavities, we talked about abscess, we talked about spread of infection. Are there even other things that can result from, not taking care of your teeth and your mouth health?
Absolutely. Most people have heard of periodontal disease or pyorrhea or gum disease. There's so many different names of it. And basically, it's another bacteria that's in your mouth up under your gums. It causes your bone to start disintegrating, but it also can increase your diabetic or glycemic levels, or your, as people say, my sugar levels I can't get them regulated no matter how much medication I'm on. Check your mouth, because if you have periodontal disease, it's a strong correlation between periodontal disease and diabetes. But yes, also if you're having heart surgery, heart issues, the same bacteria that's in periodontal disease can travel to your heart and cause different things to happen there. So it's just amazing that people don't think of the mouth, but the same bacteria that's there can travel anywhere in the body and wreak havoc. Autoimmune diseases, if you have Sjögren's syndrome, it's just different things that we can see in your mouth, and we say you need to go get this checked out, and people are like, how did you know? Well, because there are ways in the mouth, there are ulcers, your mouth is dry. There's just different things that we see that we know that there's also something else going on in your body.
So you mentioned periodontal disease. Where do you see that, and how does that manifest?
So periodontal disease, it's a lot of times people are like, well, it's hereditary, and there is some that can be hereditary. And when I say that, we all have something, we all get things from our family. However, once you have it, what are you going to do with it? Just because you have something, you can control it with going to the dentist, taking care of your teeth regularly, and you can kind of stabilize it at the level that it's at, meaning the breakdown, the bacteria. It's all about inflammation, believe it or not. If you control the amount of inflammation inside of your body, that decreases the rate that the bone breaks down.
And what does it mean when you brush your teeth and your gums bleed? Or you floss and your gums bleed?
Right. It can mean a lot of different things. If your mouth is stable, meaning you're brushing twice a day, flossing, seeing the dentist, and you don't have a high bacterial load, it could mean something as simple as you're brushing too hard. You're flossing too hard. A lot of times that is the simplest answer. That's what a lot of people are doing, especially if they're taking really great care of their mouth. They're just doing it too hard, too rough. Another thing could be that, you have some food left in there, like especially flossing. Popcorn kernels are the worst. They always get stuck somewhere They cause your
Mhm.
gums to start swelling, and that's called gingivitis. Gingivitis is reversible. Gingivitis, we're not as much concerned with because we know, again, it's reversible. You can remove it, daily flossing, you can take care of it. But it's once it continues, the bacteria stays up under your gums, it starts to break down your bone. That's when it turns into periodontal disease.
Got it. Got it. Now, let's talk about specific populations of people. Let's start with pregnant women. Why is oral care especially important for pregnant women?
So a lot of times I hear, oh, I had 2 kids and they tore my mouth up, or I had whatever. I have 2 kids and my mouth is not tore up. So it's not so much what it does to the kids or what the kids do to you. It's because you are growing a human inside of you. You kind of forget to take care of your mouth. So then you're not brushing as much as you should. You're not flossing. And then I know I was pregnant too. You eat all the time. So constant eating, you're keeping your pH in your mouth at a lower level, and it starts breaking down at a certain point. So if you're eating more, your pH in your mouth is not getting to a healthy level, and it's just the acid in your mouth is just kind of breaking down or causing that cavity or bacteria to grow, basically. So it's not so much the baby, it's the lack of the care that you're doing during those time periods that's causing that.
Got it. And now what about kids? You have your kid. How often should you be taking your child to the dentist? And what is well, let me just say that how often should you be taking your kids to the dentist?
As soon as you see the first tooth in their mouth or by the age of 1. I know people are like, well, what are you going to do? A lot of it's education at that point. Parents, they're concerned about a lot of other things. And again, the mouth, we know that it's hard to get in there. But if you start training the kid earlier to let you inside of their mouth, then they're easier to brush and floss and look around. So it's more so education, but usually we say by 1 or the first tooth.
Got it. Got it. And this was something I was really surprised by when I was, preparing for the show. How can a dental visit reveal child abuse?
So again, it's the parent's responsibility to take care of kids. We know kids cannot brush their own teeth. I mean, we definitely want them to get in there and start playing, getting used to it. However, the parents have to get in there and brush their teeth. Is taking care of the child. And so when we see a child coming in with the rampant caries, mouth full of decay, we know that there's neglect happening. And as a provider, we are forced, to bring that to the attention of authorities, because that is you're abusing your child at that point. Kids should not come into your office swollen, infections. Those things just should not happen.
Right. And then, so that's one disease that can be detected by a dentist. Are there other diseases that you can tell as a dentist looking in somebody's mouth? You might be the first provider who is able to direct them to get definitive care when you see these things.
Right. It actually happens a lot. Sometimes cancer, throat cancer, people don't know they have it. They're like, oh, I just have this thing in my throat, or it's scratchy or itchy. And then you look in there and their tonsils are huge, or just things there that just are not appropriate. And so we encourage them without scaring them. That's another thing. Again, dentistry, we focus in the oral cavity, but I can't do certain things that a physician can do, or I should say. And so we have to work together as a community to say, okay, well, this is what we see. We highly recommend you go to your doctor just to get these things evaluated. A lot of times, sometimes when people are anemic and stuff, we notice that they eat a lot of ice and their teeth, they start cracking and stuff. And we're like, what is going on? And they're like, I don't know. I just have this ice habit, or I'm eating like sand. And I'm like, why? But then they're anemic. They didn't know. So it's a lot of things, dry mouth, we can just tell things going on, and they're strongly related to other things in the mouth or body, I should say. And so we just recommend that they go get certain tests done.
Right. So it's almost a form of preventive care, going to your
Right.
dentist or better care because you're having another healthcare provider who can see things that even maybe your doctor hadn't picked up. So very important. Um, so tell us, you've been kind of talking as we've been going along. You mentioned flossing, you mentioned dental checkups. Tell us what is really an optimal oral care regimen or practice, right? How often
Mhm.
should we be brushing? How often should we be flossing? How often should we be seeing you? Should we be using teeth whitener? These are things people want to know.
Okay. So 5 minutes a day is all we ask. 5 minutes in a 24 hours, period. You can do that, right? So 2 minutes in the morning brushing. That's what we recommend. 30 seconds in each quadrant. You break the mouth up into 4 areas. That's the quadrant. We also recommend you brushing 2 minutes at night and flossing once a day, at least at night.
Not
And the
3
reason
times?
no, the reason we recommend at night is so you can get the food that you've been eating all day off. If you floss in the morning, that food has been on your teeth all night, just doing its thing with the bacteria that you have in your mouth. So just get it out before you go to sleep at night. That's just the basic. If you do that, that's what we recommend. Going to the dentist twice a year just for checkups, that's pretty much all you need to do. You don't have to have a lot of money to take care of your mouth. You don't. So do those things, cut down on the sugary drinks, cut down on snacking all day. A lot of times people are like, well, I only drink 1 soda, but if you drink 1 soda throughout the day, that's worse than just chugging it. I just tell patients, if you're going to do it, just drink it at one session and get it out the way. Because again, we talked about the pH levels inside of the mouth. Once it gets below 5.5, that acid is just breaking down that enamel. So get it out of the way if you're going to do it. What else? Whitening. I don't have a problem with people whitening. Just be careful with it. Make sure you go get your teeth checked out first, because a lot of times just simple taking care of your teeth, the brushing twice a day will make your teeth whiter than the whitening because you're not even doing the basics. So get the basics down before we try to do extra things. That's what I always recommend patients. I always want to whiten. I'm like, if you do these things, your teeth will get whiter. So what was the other question that people want to?
Oh, electric toothbrush versus regular.
So again, either one, as long as you're doing it the right way. If you have an electric toothbrush, then you let it work. I always tell patients, just go horizontal. Do not brush with an electric toothbrush. If you're doing that, you're damaging your tooth. You're taking more layers off your teeth. Again, it's no problem. Just let it do its thing. Manual toothbrush, I'm fine with too. Just don't be so aggressive. Also, people didn't ask, but people think if I use a hard toothbrush, I get more off than if I use a soft toothbrush. What you're getting off is more enamel, and you don't want to do that because the next layer in your tooth is the dentin, which is more yellow. So if you're concerned about whitening, if you're brushing too hard, you're actually brushing that translucent level of the tooth off. So soft toothbrushes, slow down. A lot of times people brush hard and fast, and that is not great. It also causes sensitivity of your teeth.
Wow, that's great. Now you said go to the dentist twice a year. You don't really need a whole lot of money. What about dental insurance? Is it something that everybody should have, or can you share your thoughts about that?
Right. So dental insurance is one of those things. It's not a terrible thing, but you have to look into your plan. If if you already know that, okay, I'm starting off with a lot of needs, like I know I already have missing teeth, I already know I need partials or I need gum treatment. Yes, then it may be in your best interest to look into a dental insurance that covers those things. And you just also want to be mindful that a lot of times they have waiting periods. So just because you sign up for a dental insurance, a lot of times you may not be able to use it for some of the higher ticketed items, as you may say, like a partial, crowns, things like that. Most dental insurances, as soon as you get it, you can get an exam and cleaning. So just be mindful of what your insurance says, the policy says. Does everyone have to have it? If you just need those 2 cleanings a year, you may not need it. Just do the cost, see what the fees are that for the provider that you go to, and see how much it would cost for you to have an insurance plan for that year. If it's cheaper for you not to have a plan, then don't get it.
Right. Makes perfect sense. And I mentioned in the beginning that you've set up free clinics in Midland, South Carolina for children and for adults. I know that's rare in most parts of the country. So for people that live in other parts of the country, are there places that you can go to get inexpensive or more affordable dental care if you're on if you're low income or on a fixed income?
Absolutely. Dental schools are great. We all had to go to dental school. And when you're at dental school, it's not that all the students are just doing anything. We're under a lot of scrutiny and we have to get checks at every step of the way. So going to a dental school is a great way to get dental for a very nominal fee. Also, a lot of places they have health centers where it's like a sliding fee schedule. So that's another way to get it. And then many states offer maybe a free dental day, a weekend. Sometimes they'll offer that. So just Google it and see kind of what your area or your state. You may want to reach out to your local health department to see kind of their recommendations or that they know a way to get those services.
Great advice. Thank you so much. I can't believe the time has flown. I think we need to bring in Wayne and Lila back into the studio to see who has questions from the chat, what's going on, how many people are flossing, all of that.
Y'all conversation is so good. You really have basically answered most of the questions in the chat. Like soft versus hard brushes.
Right.
Are there resources for people who can't necessarily afford dental care? You've really answered a bunch of the questions that I've been seeing, but I do have a couple. You have some, Wayne?
Okay.
Yes, got a few. Got one from our West Coast producer, Rhoda Lawrence. She asked, if periodontal disease is so deadly, why doesn't insurance cover it equally?
The insurance covers periodontal disease, but again, it's a little bit more involved. The process of how to treat it. So there sometimes is a waiting period, but again, that's I'm not going to get into the insurance battles or, why insurance doesn't cover most insurance. It's car insurance. A lot of insurances don't necessarily cover the things we need. So I wish I could answer that question, but that's something that you would take up with the insurance company, but I definitely understand.
There you have it.
This is a variation on a question from Yvonne Smith. Yvonne, thank you. Shout out to Yvonne Smith for giving me my flowers, my claps. Yvonne, this is a variation on her question. Are water picks as effective as regular flossing?
So, I'm old fashioned. Just do the basics first, and then you can always add a water pick. I mean, that's an extra incentive or an additive. Okay. Like, okay, you didn't get everything with the floss. Let me go in with the water pick. But if you can't floss, because some people can't, they have dexterity issues, then absolutely you can use a water pick.
Oh, that's a great answer. I never even considered that.
She must be a professional.
She must be.
She must be a whole.
My next question is from the West Coast. And it is it the same level of care for veneers? I'm out here in Hollywood. Everybody has them. Dr. Stockton, how do you care for veneers?
Okay, well, what's the question about veneers? Because people thought I had veneers. I'm like, no, these are my teeth. So many of my patients like, well, you have veneers. I'm like, no, I don't. But what was the question? What about
is it the same kind of care? Because I know people who have veneers and they do not think that they need to go and take care of theirs.
No, it's even more important because now you have an extra surface for the bacteria to attach to. So you definitely need to make sure you are brushing, flossing, going to the dentist. Absolutely, absolutely. In the margin of the veneers. We can see that if you're not taking care of your teeth. So yes.
Absolutely. Actually, Dr. Stockton, to piggyback on that, can you just break down what veneers are for the people in the back?
Right. So there's different kind of veneers, but basically a veneer is a lot of times when you want to change the shape of your teeth, especially in the front. So they, you can do it different ways, but it's a thin layer of material that we put on top or glue on top of your teeth.
Okay. All right.
Or if you've had trauma to your teeth, right?
Sure.
Yeah,
Right.
when
Yeah,
it's
like
more
a chip or
it
something
depends
like
on
that.
where the trauma is, because then you're getting to like crowns, which is a more fuller coverage, I would say. So veneers a lot of times are more so for aesthetics. They could be for like minimal trauma. So yes, it can be.
So we got a couple questions. Once again, to the West Coast, Rhoda Lawrence asks, what type of fillings are safe? What type of fillings are safe?
So, with everything, there's something wrong with everything man-made. I will say that, because people have this, this is not safe. This is not safe. There is something with everything, because I'm not going to scare anyone. Certain dental materials have been around for a long time and they still work. I will say it like that. Sometimes the things that people may want, there's also issues with those too. So I'm not getting into any, which is better if that's okay, because there's something with everything, honestly.
Okay. Got another question. Who does the root canal? Is it a dentist or a specialist?
Both can
And
do.
maybe I can ask, what are the different other kinds of dentists who are specialists, right? Maybe if you can include that in the answer too.
Okay. So a general dentist, the thing about general dentists is they can do pretty much everything. That's it. That's kind of that. You can also specialize to go into like one type of dentistry. So say you only want to do root canals or only want to focus on this area. Every component, there's a endodontist specializes in endo root canals. A periodontist specializes in periodontal disease. Oral surgeon specializes in taking teeth out. So, for more in-depth things or procedures, definitely go to specialists, but it's always a good idea to start with the general dentist, and they can help guide you to the specialist that you need to go to.
Wow.
Makes sense.
My dentist is one-stop shop. He did crowns. I've had a lot of dental work. He's put it off for me.
So
go ahead, Wayne.
No, I was just wondering, what do they call those chiclets when the when the veneers are too big? Who puts those chiclets in people's mouths?
The dentists who listen to their patients that want them.
Right.
There we go.
Got you.
Because a lot of times it's not, we think natural looks great, but people don't, unfortunately, want natural looking teeth, unfortunately.
Okay.
Yeah. Okay, so Dr. Stockton, if I just haven't been able to get to the grocery store, what is the best alternative for a homemade solution to brush my teeth with?
Water and your toothbrush.
Really? No paste, no baking soda, just water?
Baking soda is okay, but it's really harsh on your teeth. And so you want to be careful with those things. So again, just make sure before you brush your teeth, also, I didn't say this part, make sure you put water on your toothbrush bristles, because if not, even a soft toothbrush will be hard. So just water is enough. We don't have to do too much extra, right?
So women, I have a question, because one of my little favorite toothpaste has baking soda and peroxide. So
and that's okay. A little
it's
bit's
okay to have it in there. Okay, all right. Just want to be clear.
So
I
it's
was like, wait a minute,
on your
soda.
teeth. So that helps the whitening portion. So that helps with whitening. Right. Baking soda helps with whitening. But when you tell people that and doing things at home, then they're going to use that whole thing of baking soda on one. Yeah, that's too much. Too much.
Right. Okay. What about mouthwash?
Mouthwash is fun.
How often? What kinds?
Okay.
So no concern about the alcohol level in mouthwash?
We're concerned about alcohol levels in mouthwash for people that are alcoholics or have issues. So a lot of times we tell people to do Listerine Zero or non-alcoholic versions of a mouthwash. There are also mouthwashes for different things. If you have a higher caries rate, then we recommend like Actor. I don't want to do name brands, but those type of mouthwashes. If you have more of the periodontal disease, we recommend possibly like Listerine or those kind of mouthwashes. So it's pretty much kind of what your thing is, or if you don't have anything, either one works fine. But if you do have Listerine with alcohol or any mouthwash that burns when you put it in, just dilute it with water.
Okay.
Okay.
So we have another one. We have actually a statement, and I'll turn it into a question. Gloria Jean Ezekiel says we need more holistic and biological dentists. Can you tell us, do you know about holistic dentistry?
So she's probably referencing dentistry that's not as invasive, or is not asking you to do a lot of when she's saying holistic, more natural ways. So again, that's why with dentistry, just water and a toothbrush is all you need. That's the most holistic way you can get. So if you're doing those things, then you shouldn't need to do any of the other ways. But yeah, I think that's what she's kind of speaking of.
So, but will that combat bad breath?
Will that combat what?
Bad breath.
Bad breath, a lot of times people are not brushing their tongue up under their tongue, the roof of their mouth. And also is what you're eating is causing your bad breath a lot of times. So changing the things you eat can help your breath.
Okay.
Wow.
You mentioned the acid in sodas. Are there any other high acid foods that we should be avoiding?
Any acid is pretty much in tomatoes. All that has acid in it. Just anything besides water or milk, it has acid in it if you're drinking it. So it's everywhere. So again, that's why it's important to go ahead and eat if you're going to eat, drink if you're going to drink. So you just want to be mindful. And I tell people, a lot of times people brush right after they take that in. And I say, just wait a little bit, 5 to 10 minutes, sometimes even 30 minutes. Wait before you brush, because again, I was talking about how your pH gets to a lower level when you eat and drink. So just imagine your pH is at a lower level. Then you go in there and scrub your tooth, you're taking it off more enamel, doing that brushing right away. So just rinse out with some water really quick, and then give it some time, and then go ahead and brush if you would like.
All right. And I was just going to say, how often should you change your toothbrush? And then we're going to wrap up.
Yeah, we recommend like every 3 months, and if you're sick, to change it then after that.
Okay.
All right. Well, great. Listen, we have packed in a whole lot into a short period of time, all about oral care, dental care. Thank you so much, Dr. Stockton. You were a wealth of knowledge. I know everybody is on our Be Health Empowered family has left with something. I know I have. So thank you so much, Lila Wayne. Yay. Lila
Thank
Wayne, thank you. Oh, you are so welcome. And thank you, Lila Wayne, for joining us as always, bringing in word from the street and from the internet. Can't do it without you. And of course, my Be Health Empowered family for those wonderful questions. And we're going to be right back here next week. So until I see you, remember, be wise, be well, and be health empowered. Thanks for joining.